Good morning, everybody. Welcome to Coffee with Dr. Scott. Thanks for joining me on this Thursday morning here. Wow, looks like we got a few other people on already. Turn all my devices off here. Make sure we don't have any sound coming in. Anyways, we are now in the launch prep episode number 8. Super exciting. We've gone through quite a bit here with capacity and your goal setting. Last week, super fun policies and procedures. Hopefully you've all got your office system manual and your compliance manual all done and just ironed out. You feel really good about that, right? Yeah, like I said, it's not the sexiest part of it, but it is important, so make sure you're working on that over these next few weeks. Today we're going to be working on new patient procedures. One of the... I feel like I say that every week. One of the most important, but definitely your new patient procedures are super important and something that I feel like most docs overlook, take for granted maybe. Maybe they had a system and they've just kind of let it fade and they've gotten into a place where they're just comfortable and they're not really manufacturing it. So we're going to talk about that today. Next week we talk about marketing, and the week after that we talk about your financial procedures. So we really are wrapping this up here. And again, for those of you new to me, this whole series was based on the things that you should be working on at this time of the year to make sure that you're ready for 2020. You're ready for the new year, ready for the natural growth time in chiropractic offices, which is January through May. That happens again August through beginning of November, so make sure you're ready for that as well. But this launch prep series is taking advantage of this holiday time, this time when there's a lot of noise out there in the marketplace, to make sure that you prepare yourself to accept growth come January through May. In my coaching and consulting over the years, I've found that it's not so much about forcing growth. It really is more about accepting growth. If you're just ready for it, it's there for you. Most of my clients have more patients trying to get in them than they can see, and they look at me like, are you sure about that? But when they expand their capacity, they work on these things that we're working on here in Launch Prep, their practice grows naturally without them having to push. They usually tell me that it actually feels easier seeing more patients when they work on these type of things that we're working on Launch Prep. So, Casey, Brett, Jeanette, thanks for stopping by. Excuse me. Let's get going here. So, question of the week is, does it snow where you live? And if so, do you have any snow yet? Casey, I know it snows where you live, but do you have any snow at this point? We got some on Halloween. I don't know, I think several parts of the country did, which was right, my family and I went on vacation November 1st. So the night before we left for vacation, we had Halloween, or we had snow. Came back, there was no snow. But here just recently this past week, we've been getting a little bit, an inch here and a couple inches there. I'm just not a fan. Always wonder why I live in Iowa, especially during this winter. That's going to change here soon, I'm sure. But my big issue was I was actually out trying to power wash some things that needed to be power washed, and I got about 75% of the way done. And then it snowed. So now my stuff's just sitting outside. I'm waiting for the snow to go away to finish that up. Anyways, does it snow where you live? If so, is it on the ground right now? Let's talk about these new patient procedures. New patient procedures, I think I talked about it earlier in this process, especially the capacity stuff. I talked about the fact that marketing comes really late in my program, because marketing really should come very late in your planning process. Marketing is important. Don't get me wrong, I love marketing. But there's no use marketing if you can't keep the new patients you have. These new patient procedures are way more important than marketing. If you do these new patient procedures and you get them to a point that are very comfortable for you and very comfortable for the patient, you really won't need to do marketing. There's a real neat catch-22 there. You'll need a lot less marketing if you have your new patient procedures right. You'll naturally attract more and you'll get more referrals if you have your new patient procedures down, so you wouldn't need to do marketing. So here you are doing all this stuff, getting ready for marketing, and then you find you don't even need to do that stuff. So it's a much more sustainable practice if you work on your new patient procedures and you get them ironed out to a point that you are sustainable, that you're self-growing, as opposed to having doing a lot of aggressive marketing. And again, I'm not against the aggressive marketing. I'm against it when the new patient procedures are not in place. I did a series back in the fall about the 5 things that you need to do before you do any Facebook advertising. And it's a very similar process, and one of them is to get your new patient procedures in order. I see Casey has answered here. No snow right now, but we've had 2 snows already. Yeah, I think we've 2 or 3 as well. Very similar place. So now I say that, and then I'm going to back up to marketing. When we start working on our new patient procedures, we have to start with that marketing concept, because everywhere along this process that we're going to work on today, you need the branding and the messaging to be consistent. So if you are out there doing some marketing, you want to make sure it fits your branding and your image. How do you practice? Depending on how you choose to practice, which again, for those of you who know me, I don't care how you choose to practice. It's how you practice. I'm not going to tell you it's right or wrong. If you're more of a pain-based clinic, then obviously your marketing should be more pain-based. If you're more of a wellness clinic, then your marketing should be more wellness-based, not that it can't have some pain elements to it. But all the branding and marketing has to be consistent so patients know what they expect when they're coming in. The place I see a lot of doctors getting into trouble is bait and switch type of things. If they're out there doing a marketing event, some screening, a talk or something like that, and they give some special offer, but when they come in, it's a very hard sell close. That's where they get a lot of bad Yelp reviews, a lot of bad Google reviews, and things are not very kosher there. So they end up having a lot of issues. So anyways, look at your marketing, which we're going to talk about next week, but make sure it's consistent with your branding and your imaging. But as I said, you really need to focus on your new patient procedures first. That image is great, but once they come in, we want to make sure that we put ourselves in the patient's shoes. We take a look at it from their viewpoint and figure out all the things about your office. Is your office easy to find? If not, how can we fix that? How can we give directions over the phone to make sure that people don't have issues? Because all this stuff is just pushing them towards a threshold. So if your office is hard to find right off the bat, that's just going to put a bad taste in their mouth to start with, and you'll never hear about it. The patient will just have this one little thing that kind of keeps them from starting care with you, and then maybe something else will happen when they get in the office, and then the report of findings is not quite what they expected. So all that stuff adds up, and they decide not to get care. But it could start with those things: is your office easier to find? Do you need to update the directions on your website? Do you need to have your staff talk about it on the phone before they even get here? Is your waiting room welcoming? Look at it from a patient's point of view. Is the paint chipping? Is the carpet torn? All these things that, again, give the patient a first impression, we want to make sure that we have really well ironed out. It looks good. It looks professional. Is your paperwork professional? That's a big one that I make a big point of in my referral mastery program. Is make sure you don't have a copy of a copy. Some people went in as an associate. Maybe the owner left, and now you own the clinic, and you have their old paperwork, and you just keep copying it. So you get a copy of a copy of a copy. It looks all worn down, and there's words you can't even read. And this is how you're presenting to a new patient. I want you to make sure you print it, retype it if you have to, make it look professional, put some logo and branding on it, print it out nicely. I even talk about referral mastery about having it into a nice leather folio. We won't get into that today, but I want to make sure all your new patient procedures, again, from that first entrance, the way the patient is greeted, are they offered a beverage? Is the paperwork, are they helped with the paperwork to make sure they don't have issues? Because if they're sitting there doing the paperwork on their own and they have questions but they don't feel like they can answer it, there's just a little tension there. We want to remove all that friction from the new patient experience, if you will. Okay? So get inside that patient's mind, take a look through your office and make sure it's welcoming and inviting. And then we'll move on to talking about your consult and exam. I think it's here somewhere. There we go. Then we'll move into consult and exam time. One thing that I think is really, really important here is are you letting them know what to expect? Not enough doctors that I've met with are doing kind of a pre-consult, a pre-framing, telling them what to expect from this day to put the patient at ease before you start digging into their problems, letting them know how things are going to work in the office, setting up your own report of findings, setting up the care plan, and really giving them a chance to be comfortable in your space and kind of get to know you a little bit, that rapport building before you ever get into, hey, tell me what's going on with this problem of yours. So figure out some consult pre-framing. Make sure that your exam room, wherever you take them, is a comfortable space. And then also looking into your exam itself. One thing that's been coming up quite a bit here in my consulting with some of my newer clients is how important the talk over is during the exam. Is starting your report of findings right there during that. Your diagnostic presentation should happen during your while you're figuring out that diagnosis. So again, look at all that stuff. How is your patient taken back to that room? How you enter the room? How you do that pre-framing during the exam? Are you telling them what's going on with them? Are you starting to build that case in the exam? Too many doctors just sit there and they do an exam, they write something on a piece of paper, they do an exam, and they save it all for this report of findings, for this big dog and pony show, thinking that's going to sell the case. If you haven't presented a case before that, it's too late. So do it during that exam phase. But again, look at your exam, look at how it's performed right now, and is it just something that's kind of floating? It's something you've always done it this way and you've just never changed. And if that's the case, make some changes. Make it for the patient point of view. Something I missed early here is in all of this, in the patient experience, in the consult exam, and what we're getting to next is a report of findings, or whether that's 1 day or 2 day. But in all that process, I want you to look at it as to what you want from that patient. I know we're supposed to be giving them the information of what they need for their care, but what kind of patient are you trying to develop? Do you want a patient that's there 3 or 4 times and leaves, or do you want a lifetime patient? And your entire system should be developed to create that. I see a lot of patients or a lot of clients that tell me that they want more wellness patients, more lifetime patients, and yet their entire process is set up to get someone in and out of there in a few weeks. And again, however you choose to practice is completely up to you, but if that's what you want, you've got to develop that system right from the beginning. The way the patient is greeted by your front desk staff, it makes a difference as to whether they're going to stay for a lifetime or they're going to leave early. So make sure that you're looking at that. And so now during the consult and exam, what are you looking at? What are you saying to them? How are you developing the case as you're doing this exam process? How do you want it to look? Again, a lot of you are just kind of going through the motions. You're doing what you learned in school, but you're not really building a case. You're not developing that patient for what you want in your practice and how you want to practice. So take a look at that. If you're having troubles with it, schedule a call with me and we can talk about it. I think I did. Yeah, I put my call schedule for coffee down below, which has actually been filling up pretty nicely. A lot of you have reached out to me here lately during this Launch Prep program and asked questions. I see Freddie on there. Freddie, I know I'm talking to you here in about 8 minutes. I'm already open, so if you hop on, don't say anything. But no snow in Memphis Olive Branch, which is Mississippi, right? Across the river from Memphis, I believe, if I'm correct. Anyways, I'll be talking to you here shortly, Freddie. Tyler, thanks for stopping by. Matthew, thanks for stopping by. Question of the day up above. Where is it? There? It doesn't snow where you live, and if so, do you have any snow yet? Tyler, did you get hit this week? Let me know. Anyway, so exam. Now let's move on to after the exam. What do you do at that point? Do you do a day one or a 1 day full exam ready to report of findings, or do you save it for a second day? And again, however you choose to do it. I've been recommending a 1 day process here lately, especially if you have digital x-ray. There's really no reason like there used to be to push somebody back the next day. You used to have to develop x-rays and mark them and do all that kind of stuff. That doesn't really exist today. I feel like people want that information as quickly as they can get it. So I push towards a 1 day, but I won't push you in that direction. You choose how you want to practice. But figure it out for yourself. Figure it out for your patients. Do you have a report of findings at all? If not, this is a great time to get that set up and ready for January because, again, I see too many doctors that just aren't doing it anymore. They simply bring the patient in, they're like, hey, let's just see how things go, hop on the table, and they get started with somebody, and they're not developing the patient that they want. And again, what does that mean for you? But for these doctors, they tell me they want this thing, but their systems don't work that way. I want to make sure your systems work the way that you're trying to develop that patient. So, do you have a report of findings at all? And, working out the process of after that exam, do you treat on the first visit? And if you do, again, so many So many doctors have a hang up about that. They come to me like, I treat on the first visit. Is that okay? Because I've been told by some other consultant to never treat on the first visit. It's up to you. And if you want to treat on the first visit, if you feel like that patient requires some treatment that day, please do. Please give them what they want and what they need. Serve yourself. If them leaving and coming back the next day feels bad to you because you feel like you didn't do anything for that patient that day, then adjust them on the first visit. It's okay. You can develop the system how you choose to. Again, do you adjust? Do you not? Do you perform some sort of treatment? Is there a release? Is there a report of findings that day, or do you release them and say, hey, come back tomorrow? If they're coming back tomorrow, do they schedule one visit? Do they schedule two visits? How much do they pay that day? All these things are things that I find doctors aren't even looking at. They don't even know. The staff takes care of it, doesn't take care of it. The doctor might tell me, I don't even know if they pay, what they pay. And when they ask their staff, they're like, really? That's what you're doing? Who taught you that? Like the staff has just done it on their own. So I need you to figure it out and train your staff to do it that way. And then when we get to the report of findings, really want to get out of this let's see how this goes mentality. I want to get out of the hop on the table, let's get a few visits and see how we do. I want you to present a case. And I don't care what that case is. It has to come from your heart, and it has to be designed to develop that patient that you're looking for. Majority of my clients these days are doing something in a range of visits for an active care plan, but also always mentioning what they think the rest looks like. So if you're of the mindset that, hey, chiropractic's best served by you getting some sort of wellness or maintenance care down the road, we can talk about that later. Let's start here. That's fine. Again, my rule, as always, if you've been through my Perfect Case Acceptance course or you've watched me here live while I've talked about it, my rule is always to tell the patient exactly what they need and then cheerfully give them exactly what they want. So you've got to be prepared to let the patient pick their own care, but it's okay as long as you present exactly what they need, what really comes from your heart. Now, the problem comes here when you start trying to predict what they want as opposed to telling them what they need. And I've had several clients this year especially that have told me that they always kind of try to predict what they could present to this patient, what they would accept. And when they get away from that and they start telling the patient what they need, they find that patient is willing to accept more care than they thought they were. And again, that's not more care for you, although it benefits you and your business. It's more care for them. It's what's best for that patient. And if you tell them what's best for them, again, from your heart and you're honest, those patients will respond to that and most likely get more care, which again will turn around and be beneficial to you as well. But get that report of findings down into how long you think it can take. How long does it fit in your practice? Is a 5 to 10 minute report of findings enough? Do you need some half hour, 45 minute in order to present the plan that you want to? I've always found 5 to 10 minutes is plenty to get people started and in the process and into your practice. But what's going to work for you? You've got to go through all of this stuff in your new patient procedures, work it out to make sure it fits your style of practice, make sure it develops the kind of patient that you're trying to develop, and you're going to feel a lot better, more comfortable going through this process in 2020, knowing that any marketing you do will bring in new patients who will stay, who will accept your best recommendations, who will refer people, who will pay for the care. Those people who refer will then come back in through, and again, it'll be a more sustainable practice. So spend the next few weeks looking at your new patient procedures, break it down piece by piece from the patient entrance, from the patient phone call, from your marketing, from the patient phone call to the patient entrance and greeting, how they fill out their paperwork, how they're taken back to the exam room, your consult, your exam, first treatment, if there is any, report of findings. You've got to break down every one of those steps, make sure they're consistent, that they're developing that patient. And again, if you're having any trouble with that, if you're overwhelmed by the thought of that, we definitely dig even way deeper into this in my coaching program, which is open right now. How about that segue, huh? Which is open right now. If you would like to see if my coaching would be a fit for you, just schedule a call in that call down below there. That call link, it's for coffee, which is normally right now $7.20. Almost every morning I accept a call, and then I do another one I think at 9, something like that. So get on the phone with me. We can chat about your particular practice. We can figure out what's going on with you and see if my coaching would be a fit for you. I don't coach a lot of people on purpose. I try to be very hands-on with my clients, so I keep my coaching small, but we have opened up a few spots here for this January through May takeoff. So if it interests you, make sure you click on that link down below. Next week, we are going to be talking about marketing, which again, I know people reach out to me. That's always what they're looking for. So if you want some marketing ideas, we're going to share those next week. And the week after that, which should be about the week before Christmas, right? We're going to be talking about your financial procedures, making sure that your money is well taken care of in 2020. So make sure you do not miss that one. Anyways, I hope you all have a wonderful week. Like I said, if you're interested in my coaching, just go ahead and click that link down below. Schedule some time to talk to me in one of these mornings. And I'll see you all next Thursday, 7 a.m. Central Daylight Time.